Hello everybody. Welcome to this presentation on Peer Assist, part of the Knowledge Management WebExes. We did run this session live on Monday, but unfortunately we weren't able to record the session, so I'm going to re-record my presentation now. Hopefully the sound quality will be okay. I'll just run through the presentation with you, and hopefully that will give you some ideas of what knowledge management and Peer Assist can do within your own library service. So you should be able to see on the screen in front of you a presentation that we've written about Peer Assist. So the first thing to explain about knowledge management on the Knowledge for Healthcare blog is that it's been divided up into different sections. So Peer Assist comes under the section of connecting people to people. So this is the official Knowledge for Healthcare definition of connecting people to people, which is helping colleagues share ideas, question and learn, supporting networks and communities of practice. So that comes from the Knowledge for Healthcare, a development framework, page 23. So what is Peer Assist? So from the first definition I just read, we can see that Peer Assist is a tool for you to connect people to people. And the definition of Peer Assist is a structured, facilitated meeting or workshop where people are invited from other business units or other businesses to provide their experience, insights and knowledge to a team who has requested help. Okay, so that sounds all very good on the theory, but what does it mean in practice? Now, this presentation does include a number of slides which link through to other material, and because of the technology using WebEx, I would say it's probably better we will send out this presentation afterwards so that you can have a look at what the links are. This first link is through to a short animated movie which explains the practicalities of doing a Peer Assist, and it's called How to Help Bob. But what I will say is if you can look at this material afterwards, because it's not the easiest to play through the WebEx system. So that slide is a movie, as I said, an animated movie called How to Help Bob, which explains a person who has a problem or is starting a project and they wish to set up a Peer Assist, and that movie does go through the practicalities of doing a Peer Assist and running a session. However, we do have lots of other material from the Knowledge for Healthcare blog to help you to get the idea of what a Peer Assist would be, and also to how to run one within your own service. So these postcards are available on the Knowledge for Healthcare website on the blog, and they are color-coded, the postcards, according to whether you're doing learning before, during or after a particular project or an idea you might have had. So these are, the Peer Assist ones are green, which indicates that they're part of the learning before concept. So this is something you would do before you start a particular project or when you've had an idea. So on the front of the postcard, it shows you the Peer Assist. It also shows you a particular time frame on which you might do a Peer Assist. This gives you half a day as an idea. However, you don't have to stick to that. You can run a Peer Assist session for 1 hour, 2 hours, particularly if it's internal to your trust and people are already on site. If you are asking people to come from perhaps further away as visitors who are going to help you out, then you may want to make the session longer. It is very flexible. You don't have to stick to that half a day. So we've already said the definition, which is on the front of the postcard about a Peer Assist, and on the back it gives you much more information about how you would run this meeting. So you would be looking at inviting visitors in who've had perhaps previous experience, but that is thinking very laterally as well. So you might not be asking other NHS libraries or people who work in the NHS to come along and help you. They may be from business, which we'll show you an example of later, who work in a particular way, who work in teams with where everybody's doing a very specific role in perhaps a very short time frame, and they will be able to give you examples of how they made things work and how problems that they have overcome in their own business, which you can then translate into the NHS and into your own service. So I'll just run through quickly what it says about the peer assist and how you would run the meeting. So first of all, you're going to have a home team, which could be library staff or it could be other staff in your trust. So the home team will present their issues that they have or the context of their project and their plans for the future, and also what they hope to get out of the peer assist meeting. You will then pass over to your visitors so they can ask further questions to make sure they're clear what the home team are trying to do, and provide feedback about what worked well for them and what could be done better. So you're going to be, as the home team or whoever the home team are, you're going to be learning from your visitors. And this should be done, all of this should be done in a very friendly and positive way. So your visitors are not coming along to criticize you, they're coming along to help you. So you're, as the home team, or the home team will then analyze and reflect on what the visitors have said. It might be the ideas that the home team had, other people have given them pointers as to how to make this work more efficiently, or perhaps something didn't work for the visitors team, so you may discount it, or you may think we can do that in a different way, or that will work for us in the NHS or health setting. And then your visitors will provide feedback and answer questions, and you can agree some actions with the home team. So that can either be then the end of the process, in that you have just been the home team or you've just facilitated the peer assist meeting, or it can be that you agree to keep contact with the visitors, or if you're a visitor, keep contact with the home team, and you will see this as an ongoing process to help them until they finish their project. Okay, so we're thinking big with peer assist. This is quite a big concept in the business world. And again, when we send out the presentation, if you click on the spaceship on this particular slide, it will go through to an article which explains how NASA used peer assist, and they were able to use it obviously in a very a big way. So the reason that we're doing these WebExes is to break down the theory behind knowledge management and the different concepts, and then give you the tools. So peer assist is a tool, and then see how you can use it and adapt it to your own setting. So we may not be having NASA to visit, but there may be other teams within your trust that really need to talk to each other, and you can be the facilitator, or as I said, you can be the home team or even the visitors. So what about an example from a library? So again, when you get the presentation, you'll be able to watch the film clip on this slide, which is actually from a healthcare firm, is actually from the Knowledge for Healthcare blog, and that explains how the Great Ormond Street Heart team at Great Ormond Street Hospital for Children in London got together with Ferrari, and that concept of when you're working on a Formula One team car and it's come in during a race and you need to change things really quickly. You've got a big team, everyone's doing their own thing, but they understand where that all fits together. They spoke to the team who would be working in an operating theatre in Great Ormond Street and had a peer assist meeting, so they exchanged ideas about how the workflow in the theatre could work better, and all kinds of improvements that could come up. That's obviously a very big example again, Ferrari and Great Ormond Street, but really it's thinking about how you can do this on a more local level. Okay, when we did the live session on Monday, we ran an interactive exercise So when we came to this point in the presentation, I was able to put up a whiteboard within WebEx, and our listeners were able to answer this question for me and put answers on the whiteboard. Obviously, as this is a recording, this is going to be slightly different. So the interactive exercise, or the question that I asked my audience, who were all working in a library environment across different sectors, was how do I engage an established library team with a new concept or activity? So the background to this is that I've only been in my post about 18 months. And before that, I came from an academic library background, so very different to working in the NHS. And I have a very established team here at Exeter with quite defined job roles, and I'm trying to introduce a lot of new ideas to them. And obviously, we're being asked to introduce such concepts to our libraries as patient and public information and knowledge management. It was asking advice from perhaps more experienced managers as to how they would do this with their teams. So what we asked them to do was write answers on the whiteboard, and I then talked through what I was finding really useful from that, which was basically everything they said was really useful, and came up with a few more phrases like the bell bin theory and things like that that I hadn't heard of, and that I can now go back and listen to and have a look into. So we obviously, as this is a recording, not the live session, I'm not able to ask you who are listening to this to engage in this exercise, but what I can do is show you the slide, which is what our audience came back with. So I know that's very small on the slide, and we will send out the answers that we got from the whiteboard after the presentation, after you listen to the recording. But there was, as I said, there was the bell bin team roles, which I hadn't heard of. There were lots of really good ideas about knowing your stuff before you, making sure you have a thorough knowledge of something before you introduce it to your team. And setting it in the evolution of the library. That was a really good one as well. Burning platform I hadn't heard of, and really being very clear with your team, using appraisals, putting it over to them, allowing them to prioritise and see what they thought was important, but obviously with guidance from yourself. So that was really good. That worked really well. And hopefully we'll be doing an interactive exercise in some way on all the WebExes. Okay, and then what we did was during the live session, we were asking people to send questions to the host, who in this case was Sue Robertson, via chat, so that we didn't have people talking to us at the same time. And she collected and collated the questions, and then we had a chat at the end. So again, I understand that Sue is going to send out as a written record the questions that we were asked, and also the answers that I gave on the day. Okay, so more detail is available on the Knowledge for Healthcare blog. So again, when you get the presentation, if you press on the link, you will get a very detailed version of the Peer Assist postcard helping you to run a session. A question we did get on the day was, does it all have to be done in person? We know that getting people to meet together is very difficult, and I think this is where our lateral thinking will come in. So it is a really good idea to get people together face to face. We know that that's very productive, but obviously it has its own problems. So you can think about doing a peer assist, maybe the preparation by email, and there's lots of technology out there to help you if you want to run a virtual session. There are things like Padlet, Yammer, even something like a WebEx, so if you can get people together in different locations but actually run the face-to-face session virtually, that's another way of thinking about the peer assist. So really thinking about what your project is, who you're going to be getting together, if they're within your own trust or you're helping to facilitate teams having a peer assist to get across the trust, that's probably going to be easier to run face-to-face than if you are, like with these WebExes, we're all across the country. So the WebEx is a good tool to allow us to talk to each other without having to meet in the same room. So have a look at those pages, and as I said, they do give much more detail and more guidelines as well. That was another question from the live session, was wanting guidelines of the role of facilitator, and these pages on the Knowledge for Healthcare blog do give a lot more information about that. Okay, so I hope you found this session useful. It is obviously a lot shorter than the live session, but there's a lot, once the presentation is sent out, there's a lot of links for you to look at and other information. And yeah, I would really advise having a look at the How to Help Bob movie, because that does explain the practicalities of the peer assist meeting. And also it might be yeah, very useful to so that you can visualize what we're talking about by peer assist. So remember that peer assist is one of the tools for connecting people to people. So this is what we're trying to do with the WebExes, is to break down the enormous concept of knowledge management into different separate ideas, such as connecting people to people, and then under each heading giving you an example of one of the tools that you could use. So peer assist is one of the tools that you can use to get people to connect together, network, talk to each other in a very facilitated and positive way, and then to learn from that for their future projects. Okay, so the next WebEx will be at 10 a.m. on Friday the 29th of September, and that will be under the heading, knowledge management heading, of people to corporate knowledge. So this is actually connecting people to knowledge that will be in your business, in your trust, and the tool that we'll be discussing on that WebEx is knowledge harvesting. So I hope this has been useful to you, and apologies again that we had to re-record it, and I hope the quality is okay, because I'm just talking to myself in a room at the moment. I don't know what it sounds like to you. So thank you very much again, and we've learned a lot from setting up these WebExes, and hoping that it's demystifying the theory of knowledge management and explaining to you that there are tools out there to help you. So we look forward to you participating in other WebExes, and thank you again.